Welcome to our channel, where we explore essential health topics that affect millions of people around the world. Today, we're discussing a condition that you may have heard of or even experienced: iron-deficiency anemia. This is the most common type of anemia globally, and it can have a significant impact on your daily life. Whether you're feeling unusually tired, experiencing shortness of breath, or just curious about what causes this condition, you're in the right place. In this video, we'll dive deep into the causes, symptoms, treatment options, and the pathophysiology of iron-deficiency anemia. Let's get started. What is iron-deficiency anemia? Lack of iron pallor is a condition that emerges when your body needs sufficient iron to deliver sound red platelets. Red platelets are essential since they contain hemoglobin, a protein that ties oxygen and transports it from your lungs to the remainder of your body. At the point when you need more iron, your body can't deliver sufficient hemoglobin, prompting a decreased number of red platelets. This implies your tissues and organs don't get the oxygen they need to work productively, causing side effects like exhaustion and shortcoming. Lack of iron weakness is especially normal in ladies of childbearing age, small kids, and those with persistent ailments. Understanding the underlying drivers of this condition is the most vital phase in tending to it. Causes of iron-deficiency anemia. There are several potential causes of iron-deficiency anemia, and they often vary depending on age, gender, and overall health. Let's explore the most common ones. Inadequate iron intake. One of the most direct reasons for lack of iron sickliness is deficient iron admission. Iron is tracked down in different food sources, including red meat, poultry, fish, beans, lentils, and verdant green vegetables like spinach and kale. In the event that your eating routine misses the mark on iron-rich food varieties, or on the other hand, assuming you're following a veggie lover or vegetarian diet without legitimate preparation, you may not be getting sufficient iron to address your body's issues. This is especially valid for youngsters, teenagers, and pregnant ladies who have higher iron necessities. Increased iron demand. In specific phases of life, your body's interest for iron increments. For example, during pregnancy, a lady's body needs more iron to help the developing hatchling and placenta. Essentially, kids and young people going through quick development sprays require more iron to help their creating bodies. Ladies with weighty feminine periods are additionally in danger of creating lack of iron paleness, as they lose more blood, and hence more iron, every month. Blood loss. Blood misfortune is a critical reason for lack of iron pallor. At the point when you lose blood, you additionally lose iron. Persistent blood misfortune can happen from different sources, for example, gastrointestinal draining because of ulcers, polyps, or diseases. Customary blood gifts, albeit by and large protected, can likewise add to press lack in the event that not oversaw as expected. Furthermore, weighty feminine draining in ladies is a typical reason for lack of iron frailty, as it brings about a reliable loss of iron after some time. Poor iron absorption. Regardless of whether you consume sufficient iron, your body may not ingest it proficiently. A few circumstances can debilitate iron ingestion, including celiac illness, Crohn's sickness, and certain gastrointestinal medical procedures like gastric detour. These circumstances influence the small digestive tract, where most iron assimilation happens, prompting iron lack sickliness in any event, when dietary admission is adequate. Symptoms of iron-deficiency anemia. Different individuals experiencing symptoms like fatigue, shortness of breath, dizziness, and pale skin. Lack of iron sickliness can give a scope of side effects, some of which might be unobtrusive and not entirely obvious. How about we investigate the most widely recognized side effects you ought to know about? Fatigue and weakness. Weariness and shortcoming are among the most widely recognized side effects of lack of iron weakness. At the point when your body needs more hemoglobin to convey oxygen to your tissues, you can feel uncommonly drained, even following an entire night's rest. This consistent weariness can make it hard to focus, perform everyday errands, or take part in proactive tasks. Pale skin. Fair skin is one more trademark side effect of lack of iron sickliness. This happens on the grounds that there are less red platelets coursing in your body, giving your skin a paler appearance. You could see this whiteness particularly in front of you, within your lower eyelids, or your nails. In the event that you suspect you may be frail, checking these regions can give a speedy visual sign. Shortness of breath. Windedness, especially during actual work, is another normal side effect. With less red platelets and less hemoglobin to convey oxygen, your heart needs to work harder to convey oxygen to your muscles. This can amaze you feeling after even gentle effort, like climbing steps or strolling brief distances. Dizziness and headaches. Tipsiness and migraines are additionally side effects of lack of iron paleness. At the point when your cerebrum doesn't get sufficient oxygen, it can bring about sensations of wooziness, or in any event, swooning in serious cases. Migraines are one more result of decreased oxygen conveyance, which can prompt successive and relentless inconvenience. Cold hands and feet. Do you frequently feel chilly, particularly in your grasp and feet? Cold furthest points can be an indication of unfortunate flow, which is one more outcome of sickliness. Without enough red platelets to convey oxygen and supplements, your body battles to keep your furthest points warm, prompting cold hands and feet, even in warm conditions. Brittle nails. Weak nails are one more less notable side effect of lack of iron sickliness. In the event that your nails are slim, feeble, and break effectively, it very well may be an indication of lack of iron. This condition, known as koilonychia, makes nails become spoon-formed and foster edges. While it could appear to be a minor corrective issue, it's a significant mark of your general well-being. Unusual cravings. An uncommon side effect of lack of iron sickliness is pica, a condition where you foster desires for non-nutritive substances. This could incorporate desires for ice, soil, starch, or even chalk. While the purposes behind pica aren't completely perceived, it's accepted to be connected with the body's endeavor to get missing supplements. Assuming you experience these desires, looking for clinical advice is significant. Diagnosis and treatment of iron-deficiency anemia. On the off chance that you suspect that you have lack of iron pallor, the initial step is to see a medical care supplier for a legitimate finding. This normally includes a blood test to really take a look at your hemoglobin, hematocrit, and ferritin levels, markers that show how much iron your body has put away. Once analyzed, there are a few treatment choices accessible, contingent upon the seriousness of your condition and the hidden reason. Dietary changes. One of the primary lines of guard against lack of iron sickliness is to build your admission of iron-rich food varieties. Integrating more red meat, poultry, fish, beans, lentils, and salad greens into your eating routine can assist with helping your iron levels. For the people who follow a veggie lover or vegetarian diet, it's particularly critical to incorporate plant-based wellsprings of iron, like tofu, vegetables, and invigorated cereals. Matching these food varieties with L-ascorbic acid-rich food sources, like citrus natural products, strawberries, or chime peppers, can improve iron ingestion, making it simpler for your body to utilize the iron you eat. Iron supplements. As a rule, dietary changes alone may not be sufficient to address lack of iron sickliness, and your PCP might suggest iron enhancements. These are regularly taken orally and come in a few structures, including ferrous sulfate, ferrous gluconate, and ferrous fumarate. It means quite a bit to accept these enhancements as coordinated by your medical services supplier, as taking an excess of iron can prompt secondary effects like stoppage, queasiness, or even iron poisonousness. On the off chance that you experience any unfriendly impacts, make certain to talk with your primary care physician, as they might change your measurements or suggest an alternate type of supplementation. Treading underlying causes. On the off chance that your lack of iron frailty is brought about by a hidden condition, like gastrointestinal dying, weighty feminine periods, or a persistent illness, it is vital to address that condition. This could include prescriptions, surgeries, or other clinical mediations to stop the blood misfortune and permit your iron levels to recuperate. For instance, ladies with weighty feminine draining could profit from hormonal medicines to lessen bloodstream, while those with gastrointestinal circumstances could require explicit medicines to control draining or irritation. Intravenous iron. At times, especially when oral iron enhancements are not successful or endured, intravenous, iron might be important. This includes overseeing iron straightforwardly into your circulatory system through and which can rapidly renew your iron stores. Iron is generally saved for those with extreme paleness, constant kidney illness, or gastrointestinal circumstances that debilitate iron retention. While it's a more forceful treatment choice, it tends to be exceptionally successful in raising iron levels quickly and further developing side effects. Blood transfusions. In the most serious instances of lack of iron weakness, where the pallor is perilous, a blood bonding might be required. This gives a prompt inventory of solid red platelets, further developing oxygen conveyance to your tissues. Blood bondings are regularly held for crisis circumstances, for example, when somebody has encountered huge blood misfortune, or when their hemoglobin levels are perilously low. While bondings can be life-saving, they are not a drawn-out arrangement and are utilized close by different medicines to address the hidden reason for iron deficiency. Pathophysiology of iron-deficiency anemia. Now that we've covered the causes, side effects, and treatment choices, we should investigate the pathophysiology of lack of iron sickliness, the study of what's going on inside your body when you need more iron. Iron's role in the body. Iron is an imperative mineral that assumes a few vital parts in the body, the most significant of which is its job in delivering hemoglobin. Hemoglobin is the protein in red platelets that delivers to oxygen in your lungs and conveys it to tissues all through your body. Without enough iron, your body can't create sufficient hemoglobin, prompting less and more modest red platelets. This condition is known as microcytic weakness. Moreover, iron is put away in the liver, spleen, and bone marrow, where it's accessible for some time later. At the point when your body's iron stores are exhausted, it focuses on involving the accessible iron for basic capabilities, which is the reason beginning phases of lack of iron may not cause clear side effects. Reduced hemoglobin production. At the point when your body is coming up short on iron, it can't create hemoglobin as proficiently. Accordingly, the red platelets that are created are more modest and contain less hemoglobin. These more modest cells are less successful at conveying oxygen, which is the reason you might begin to feel the side effects of pallor, like weakness and windedness. Over the long haul, as iron levels keep on dropping, the quantity of red platelets in your body diminishes, further compounding these side effects. Impaired oxygen delivery. With less and more modest red platelets, your body's capacity to convey oxygen to your tissues is compromised. This hindered oxygen conveyance can influence basically every organ framework in your body. For instance, your cerebrum may not get sufficient oxygen, prompting unsteadiness, migraines, and mental hardships. Your muscles may likewise battle to perform, causing shortcoming and windedness during actual work. In extreme cases, your heart might work harder to make up for the absence of oxygen, which can prompt heart palpitations or even cardiovascular breakdown whenever left untreated. Compensatory mechanisms. To make up for the decreased oxygen conveyance, your body starts a few compensatory instruments. One of the most observable is an expansion in pulse, as your heart works harder to siphon more blood to convey oxygen. You could likewise see that you inhale all the more quickly, as your body attempts to increment oxygen admission. These components can serve somewhat, however, they likewise overburden your cardiovascular and respiratory frameworks, which is the reason early finding and treatment of lack of iron paleness are so significant. Long-term consequences. On the off chance that left untreated, iron inadequacy paleness can prompt serious long-haul well-being outcomes. Constant iron deficiency can cause huge exhaustion and shortcoming, influencing your capacity to work out, and appreciate day-to-day exercises. It can likewise hinder mental capability, especially in youngsters and youths, possibly prompting formative postponements and learning challenges. In serious cases, delayed iron inadequacy can prompt heart issues, including a developed heart or cardiovascular breakdown, as your heart battles to make up for the absence of oxygen. For pregnant ladies, untreated iron lack weakness builds the gamble of preterm conveyance, low birth weight, and confusions during labor. Iron-deficiency anemia is a common but serious condition that can affect your quality of life if left untreated. The good news is that it's usually manageable with the right combination of dietary changes, supplements, and medical treatment. If you're experiencing any of the symptoms we've discussed today, or if you're at risk due to factors like diet, pregnancy, or chronic illness, it's important to speak with a healthcare provider. Early diagnosis and treatment can make all the difference, helping you regain your energy and live a healthier, more active life. Thank you for watching. If you found this video helpful, please give it a thumbs up and share it with others who might benefit. And don't forget to subscribe to our channel for more health and wellness content. Stay healthy, and we'll see you in the next video.